Other cancers also can be identified by their genetic testing. What type of cancer? Like which are the commonly occurring cancers which you can identify?
One is breast cancer we can pick by genetic testing, and even GI cancers, like cancers of the colon. So there are certain genetic markers for that, and even ovarian cancers also can be because of the same genetic damage. So very few cancers we have a protocol and a guidelines which has a strong genetic spread. So that we assess the patient and then we get it done. But certain cancers like you take in females only, when I talk about cervical cancer,
Correct.
I think that is the second most commonest cancer in India, especially developing countries.
Absolutely.
Because I think even educated people are not going forward for a pap testing. So certain cancers, just by doing simple testing like a pap smear, you can completely prevent or you can treat cervical cancer. That is again one more.
Since you diagnose right in time.
Right in time. So I think among females, I would always mention that all females should be very careful about breast cancer and cervical cancer. If you're above 40 years, every year you have to get a mammogram done. And if you're above 21 years, you have to get a pap smear testing done once in 3 years. The moment the female becomes sexually active, you have a chance of developing cervical cancer. That is why in Victor Hospital, we are stressing more on giving vaccination for cervical cancer. Even the government has taken an initiative.
Yes.
So we need to fight cervical cancer and prevent it. That is a very major cancer where death is very common.